So, back when I was about 15 or 16, I started to have strange pains in my lower abdomen and pelvic region. I had gotten my first period at age 13, but it had come pretty irregularly after that. I went to multiple doctors, had all kinds of tests, from blood tests to ultrasounds to a colonoscopy. Yep, that was super fun for a 16-year-old. But no one could figure out what was causing my pain. One doctor even advised my mom to get me psychiatric help because he just knew I was making it up for attention. Luckily, we tried one more doctor who performed a procedure called a laparoscopy and finally found the cause of my mystery pain: endometriosis. At the time, I had never even heard of endometriosis, and I had no idea what it was. The information I could find on it was super confusing, and it varied greatly from place to place. Now that I've been dealing with it for around 15 years, I thought it might be helpful to make a little video on the basics of endometriosis, commonly known as endo by my fellow sufferers. So, if you're one of the unlucky millions, yeah, I said millions, of us with endometriosis, I'm sorry that you're going through this, but I'm glad you're here. I hope you leave this video armed with knowledge that you'll carry with you to all of your future appointments. So, for starters, endometriosis is tricky. Multiple endo specialists have compared studying it to trying to nail jello to a tree. If you try to use the internet to do research on this disease, you'll shortly find that the origin, description, and treatment of it varies from site to site. Because of these discrepancies, you have to be very careful on where you get your information. I would never advise relying on only one source for your info, whether it's on endo, a project for school, or some random trivia question you're determined to find the answer to so as to prove that coworker wrong. As Abraham Lincoln said, you can't believe everything you read on the internet. With that being said, there are sources out there that seem to be putting patients' needs above the drug companies' wants. I've linked a few of the more reputable sources in the description below if you want to check them out. Now that the disclaimers are out of the way, let's get on to the actual basics. So question 1 has to be, what is endometriosis? Again, it's tricky, but the general consensus seems to be when tissue that somewhat resembles the lining of the uterus or womb is found outside the uterus. So to break that down further, inside of the uterus is tissue known as the endometrium, also called the endometrial lining. After a period, the top layers of the lining of the uterus start getting nice and thick, hoping for a cute little bundle of new baby cells to snuggle in. If no future baby shows up, that lining starts to break down and is shed, causing what we know as a period. If you have endometriosis, lining very similar to what's in the uterus is found elsewhere in your body. Most commonly, it's other places in your pelvis, but can occasionally be found in the abdomen, chest cavity, or elsewhere. What causes the main problem is that the lining hanging out in other places in your body also builds up, breaks down, and sheds. But unlike the tissue of your uterus, that tissue has no exit. Since it has nowhere to go, it just hangs out where it is and causes scar tissue, which doctors usually refer to as adhesions. These adhesions can cause pain and a really unfun phenomenon in which organs get stuck places they shouldn't be. So basically, it's unpleasant. But what are the symptoms? That takes us to question number 2. If you gathered a group of 10 women suffering from endometriosis and asked them what symptoms they deal with, you'd most likely get 10 different answers. The most common ones seem to be painful periods, pelvic pain not during your period, pain during sex, bloating, painful bowel movements, painful urination, and infertility. Again, this is far from an exhaustive list because some people experience all of these and more, while others experience no pain or discomfort at all. For some reason, many people believe that having debilitating pain during your period is normal. It is not normal. If your period is so painful that you can't do your regularly scheduled activities, you need to talk to a qualified medical professional. Speaking of medical professionals, question number 3 is, how's it diagnosed? If you go to your doctor and he or she diagnoses you with endometriosis just by doing a pelvic exam, listening to you describe your symptoms, or even with an ultrasound, please find a new doctor. While they're getting closer to being able to diagnose endo with a blood test, at this time the only way to confirm a definitive diagnosis is surgically. usually meaning a laparoscopy like what I described earlier. Once you've had your procedure and receive an official diagnosis, your physician will usually tell you what stage your endometriosis is qualified as. There are 4 stages, labeled stage 1, minimal, 2, mild, 3, moderate, and 4, severe. The stages simply correlate to the extent of the spread of the tissue, how involved other pelvic structures are in the disease, and the extent of the adhesions. What throws people off about the stages usually is that the stage level has nothing to do with pain level. Someone at stage 1 might have horrific pain, while someone at stage 4 might not even know they have the disease at all. See, it's things like this that cause me to say that it's a tricky disease. So, you've seen your doctor, you've had your laparoscopy, and gotten your diagnosis. What's next? That brings us to question number 4. How's it treated? I hate to say it again, but endometriosis is tricky. At this time, there's no cure for endometriosis. All doctors can do is treat it to the best of their ability, which is difficult since they mostly disagree on how to do that. As of now, the treatments generally offered are excision surgery, ablation surgery, hormonal treatments, and hysterectomy. Unfortunately, only one of these options actually treats the endo. Excision surgery is currently considered the gold standard treatment, but ablation surgery is the one most commonly performed because it's cheaper, easier, and because a large amount of medical professionals seem to believe that they do the same thing. The best way I can think of to show the differences between excision and ablation is to have you think of a weed planted in the ground. Ablation surgery, sometimes referred to as fulguration, cuts the weed off where it touches the dirt. For a while, you would probably believe the weed is gone, as to the naked eye, it is. However, the root is still there, deep under the ground, just waiting to resprout. Excision surgery, on the other hand, digs in deep and removes the entire root system of the plant. It can't guarantee that another weed will never sprout in your yard, but it tends to at least have a better long-term chance of preventing it. Hormone therapy is, again, tricky. While some people have temporary symptom relief with hormonal treatments such as birth control pills or shots, other hormonal treatments are something you should heavily research before agreeing to. Just trust me when I say that one of the main medications usually offered for endo is something that could leave you with permanent side effects. As for hysterectomy, please don't let yourself be talked into that one unless you have done your own research, worked with your doctor, and then done some more research. While hysterectomy can be a valid treatment for a disease that sometimes goes hand in hand with endo, called adenomyosis, it is not a cure for endo. Of the around 400,000 hysterectomies performed each year in the US, nearly half are done for endometriosis, which just results in a woman having a major, life-changing surgery with no actual relief. Pregnancy and menopause are also sometimes touted as being curative, but that's also false. Wow, now I feel like a real downer. I'm sorry for telling you all of this, and I really hope it doesn't make you feel defeated. Endo is a really terrible disease, and I wish I had better news for you. I do believe that strides are finally being made in researching both the cause and the treatment, and I really hope that in my lifetime we'll see better outcomes. The only thing I can really say for now is that you are one of roughly 176 million women in the world that have endometriosis. If everyone in the world with endo formed their own country, it would be the 8th largest. That's a huge amount of people. Huge amounts of people have the potential for huge amounts of voice. We need to speak up and let people know that endometriosis is a disease, and we demand access to quality education and care. On average, people with endometriosis aren't diagnosed for 7.4 years after the onset of symptoms. That needs to change. Don't ever let anyone tell you that your pain doesn't matter, and don't ever let anyone tell you that your pain isn't real. You are your own best advocate. If you learned something new with this video, please go ahead and hit the like button down below. This is the first video in a series that I have planned called The Basics, which will be short little videos that give the basics of various diseases and conditions. I would love it if you wanted to stick around by hitting the subscribe button as well. If you're a social media lover, here are the links to my social media goodies. Thanks again for watching, and I'll see you guys next time.
Action! Wait. Wait. Action!
I think I'm okay. Crap. Oh, shoot!
For real.
Me too!
I'm only thinking of you.
You'll shortly find... If you try to do the internet...
You're trying to do the whole internet.
Do the internet, the whole thing! See, this is what happens when I've only done this once! So used to having 50 times to do it! I would never advise relying... There's something wrong with you. Or some random... Oh my god! What is wrong with this?
You sound like Yoda when you do.
Don't die. If you die, I'm not ending all this.
No, come on! Well, I haven't really given much information yet, so you're probably off the hook.